Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video today was put together by Mike and Alex of the Bob and Brad crew. Both are physical therapist assistants and both have been providing treatments to our patients for years. They do
Fantastic work.
fantastic work.
We're very happy with all the work with their patients. We have reviewed and approved all of their material that they're bringing up. So they're showing you our treatment through them with their experience, and it's been
Exactly.
a wonderful.
So make sure you subscribe to the Bob and Brad crew channel, in which they do reviews of products that keep you healthy, fit, and pain-free. They handle all of our new products now. Enjoy the video.
Good luck.
Welcome, folks, to the Total Knee Replacement Fitness Program. I'm Alex, physical therapist assistant.
I'm Mike, physical therapist assistant.
And this is higher level exercises, 4 to 8 weeks, once your range of motion and walking quality is improved. So we're talking, this might not make sense right now, your range of motion your straightening needs to be at 0, that's absolutely straight, and your bending should be around 90 degrees, which is just a right angle there,
A
right?
right angle in your knee with your hip.
Yep. If you're still not at totally straight in your knee, keep working on it. We're not saying advance to these, if you're not ready, but this is
Yes, figure out
A
which
guideline.
ones seem comfortable to you and try these. If you're behind, stick to the range of motion and phase 1 of the program or the earlier exercises till you feel more comfortable and then progress to these. Some people will be ready for these a little early, some people a little later. It kind of varies.
Yep, everybody's different. The goals of this phase here, number 1, max knee bending. So you should be at about 90 right now. We want to get you to all the way back to about, everybody's different, 120, 125, some people maybe 130.
Yep, and like 100 and 110 are functional. Your surgeon will tell you ahead of time what their goal is for
Yep.
you. It kind of depends upon your knee and how damaged it was prior to this.
Yep.
So not everyone's going to get 120, but we'll progress towards what you can get functionally.
Yep.
So goal number 2 is to progress your surgery side. So if my right one was my surgery, to try to equal the strength of my non-surgical side. If this knee's bad too, you might actually surpass it.
Sure.
But
And a lot of people surpass it really early on, so.
yes, but the goal is to get both legs in this phase to be about equal strength or closer to.
Yep. And number 3, determine your appropriate assistive device, if any. I mean, you're probably using a cane at this point. Determine, should I still be using a cane, or should I ditch the cane, get rid of it? Or, some people even, if they're not doing well, they'll even grab the walker again for a while.
Yeah,
so
and
you gotta
if
determine
you've been
what you
using a
need.
walker for years because you have bad balance and you had a knee replacement, you're probably still going to be on a walker. I mean, if your balance is poor, it might be different, but we're talking
Yep.
about for the average person that wasn't using an
Yep.
assistive device before
Yep.
this.
A lot of people in this stage, get rid of the cane here now, or they're still working with the cane. Everybody's different.
Yep.
And note, if it hurts, don't do it. You got to know the difference from pain versus stretch. You're still going to be stretching. It's still going to give
Yep.
you a stretching pain, but those sharp pains, those you have to avoid.
Yep, so don't push it. Just do what, it's going to be kind of painful, but not agonizing. Like, this is getting worse type feeling.
Yep. You
So,
shouldn't digress in this stage. So
Yep.
the exercises, I'm going to demonstrate number 1. Is that okay?
I'll suppose I'll allow it today.
Don't get mad. All right, so you're going to have to use your imagination here a little bit. Number 1, this is called a step flexion stretch or a step knee bending stretch. So that's the goal here. So imagine these are my handrails on some stairs, and my right knee, this is the affected knee. So all I'm going to do is put my foot up on the step, probably, an 8-inch to 12-inch step, I would say. And I'm going to bend forward. See how my knee is bending? Go as far as you can until you can't go any farther, and then hold it for about 5 seconds. Okay, and then back off slowly.
Make sure you have sturdy handrails before you do this.
Yep.
And some people just do 1 step. Some people will go up like 2 steps. Depends on your flexibility and how much range of motion you have in your knee at this point in time.
And some people will go as far as they can, and then they'll kind of drop their butt down to get sneak a little more motion in there. So
this is more of a range of motion stretching exercise versus a strengthening builder.
Yep, this is range of motion. That's goal number 1. Number 2,
is sit to stands after I just moved the chairs.
Michael.
Sit to stands. Try to go without your arms. If you need momentum, you can kind of keep them here to rock up and
Yeah.
push. If you're not quite there, start with using your hands. If you need one hand, then you can try 2 hands on lap maybe,
Yep.
pushing up.
Yep.
The goal is if one side is weaker than the other, say this is my strong side, you're going to see people getting up like this.
Yep. And this is a big one, the pain versus a stretch. If it's really hurting your knee when you're trying to get up, use your hands. Use
Yep.
your hands.
Yep.
You got to work up to that.
Sit with armrests on your chair.
This is strengthening and range of motion. That's what I like about this one. You're bending your knee as you're sitting down, and you're also getting some strengthening out of it.
Oh, this is another one. I remember what I was going to say.
Finally.
If you're early on, you're probably kicking your leg out. By this time, you should try and get both your feet equal with each other when you stand. 'Cause
Yep.
It's going to engage the muscles equally.
Yep, equal
So.
strengthening from side to side.
Yep.
All right. Number 3. These are called standing exercises. There's 5 of them. I'm going to run through them quickly here. You're going to want something to balance. You could either hold your steps in the house. You could go behind a chair.
Countertop.
Walker. The sink works real well because you can actually grab a hold.
You
But
can do the dishes.
no, that's not an option.
Oh.
All right. So I'm going to go behind the chair. I'm going to kick out to the side. My toe is pointing straight forward. I'm going out to the side.
Rotate. If I'm giving a front view, he's just kicking out to the side like this.
We're working this muscle here. And then
Feels
you're
work-
going to kick backwards. Now we're working your glute max, your big butt muscle.
These ones shouldn't be very hard. You're going to do these on both legs.
Yep.
So you're going to do a set of 10 reps on the right leg, and then you're going to switch and do a set of 10 on the left leg.
That's a good point because you want to get that weight bearing on your bad knee
Yep.
as well as it moving. And then you're going to do marching in place. I turn to the side, because I run into the chair. And I have good enough balance at this point.
You do?
Well, sometimes.
You're working on it. You can
I'm
also
working
do
on it.
these at a walker, too,
Yep.
if you want. If you don't need balance, then you don't have to hold on.
Yep.
But
And number 4 of these is mini squats. I'm not expecting you to get to 90 degrees. Just use good form. Get your butt back like you're going to sit in a chair.
Yep.
And then back up
Just
slowly.
a slight knee bend. You don't want to bring your knee way forward. Do a bad one once. Yeah, don't do that. If your heels are popping up, you're probably going too far. You're going in the wrong place.
Yep.
Pretend you're just sitting in a chair. If you
Yep.
want, put a chair behind you. It's kind of like doing the sit the stands.
Yep. And then the last one, we call these calf and toe raises. You're just going to go up on your toes and then lift your toes. All your muscles in your legs get weak when you have a knee surgery because, you're favoring those muscles. So we have to strengthen them all back up.
Yep, just do both of these together. If you get stronger, eventually over time, you can try doing single leg. But right now, just stick to double. It's just
Yep.
going to be easier. These are a smaller muscle group, your calves are. So,
Yep. Good for your balance, too.
yeah, if you have poor balance, do these as well.
Yep.
Number 4. I can't really demonstrate this because we don't have a stationary bike. But
We'll
riding
just talk about it.
a stationary bike or a new step machine or something like that, it's just going to get more endurance and muscle built up in your leg doing the revolutions like that.
Yeah.
You could just shoot for 5 minutes to start if you can handle it. Increase your workload, so the amount of resistance as you feel comfortable. Start with 0 or 1, whatever the lowest setting is. Don't put any like inclines or variations. Over time, you can build up what level you're doing and just kind of take it easy. You might start further back from the bike if it's kind of a recumbent style, or higher up if you're doing more of the vertical style bike. We'll kind of show some pictures here of the 2 different types you can use.
Yep.
But it's just a good exercise, build up some strength and endurance, helps with your walking and everything else.
More of a dynamic exercise, maybe break up a little scar tissue that still remains there.
Yep.
Get yourself back to functioning and moving, like a normal person. All right, number 5, single leg stance progression. So I'm going to start with both hands on the chair. I'm standing on my bad side. We want this side to be able to equal the other side. That's the ultimate goal.
Yep.
So then I'm going to drop a hand if I'm feeling comfortable. And if I'm feeling really good, I'm going to drop the other hand.
Or you can go to fingertips.
Or
as
fingertips, yep, you go to fingertips. Drop the other hand. And if I'm really feeling good, I'm going to close the eyes a little bit.
Well. Uh-oh. He's
Oh.
getting crazy now.
So you want to build up to being able to do that for 30 seconds.
And try that on both legs as well,
Yep.
because you'll see if one side is worse than the other.
Yep.
Maybe your other side has poor balance too. It's just something to work on.
Yep. We want to equal out the right side and your left side. You're affected.
You're prone to falls in the past. Maybe have someone hold on to you for this one.
Yep.
Like use a gait belt or just a normal belt. Just grab on.
Yep.
So
Good spot to be at that kitchen counter. So
yeah,
you
if you don't
fall.
feel safe, but hold on if you feel comfortable.
Yep.
Number 6 is step ups and step downs. So unlike our other video showing you how to do stairs without pain, this is to strengthen your leg. So you'll use a step. It can be a 4-inch step. It could be 8-inch, 12, whatever you kind of have at the house.
Yep. Start with 4, I would say. Always start low.
Use the railings to start if you need them. I would recommend them. So if my left side is my surgery leg, you're going to actually use that one to go up with. So if I'm doing a forward step up, I'm just going to go up, and I'm trying to use this leg. Bring your other foot, and you can just keep it here and go back down.
Yep.
We have people hold on to the railings. Now, once you start to get stronger, try not to hold on and try to control it, because what happens is people will pull,
Momentum.
and then they'll go like this.
Yep.
You try to control it as your pain subsides more and you feel stronger. So try to go up,
Yep.
then try to control it on the way down.
Almost picture your quad muscle contracting to lift you up.
Down is a lot harder than controlling it than just going up. Try not to push too much with your good leg either, because if I'm just pushing, this leg's not doing a thing.
Yep.
So think about this leg engaging and using these muscles in your quads and your hamstrings.
Yep. And same idea as squats. Don't let your knee go past your toes there. You want them to
Yep,
stay
don't
in
go
line.
way up. Just
Yep.
keep them nice and up. And then for step down, you're going to actually start going down with your good side first, because that's going to make your bad side bend and control.
Yep.
Once you get to a point, your heel is going to pop up this, but just try to control it. Use the railings initially. Try to control the downward steps.
And this one, make sure you have good range of motion the first time you try this. Good bending. Good
Yeah,
bending.
if you don't have a good bend, you're going to get to here and you're going to go out. And you're
Yep.
gonna
And you could
flop
be
down.
in a world of hurt.
Yes.
All right, that's 4 to 8 weeks once range of motion is improved. Anything else you want to say?
Check out all the other programs that Bob and Brad do on bobandbrad.com/programs, and you could check out other ones related to the total knee replacement fitness program.
Well said. Thank you.